Hi, and welcome to another episode of She Leads Biotech, the podcast where we celebrate the achievements of women in the life sciences. From an early love of writing and storytelling to a passion for science sparked by an AP English essay on the Ebola virus, today's guest's path was never linear, but it was always led with conviction. 2 weeks before starting a journalism degree, she followed her gut, changed course, and entered biochemistry, a decision that would shape not just her career, but her sense of purpose. By her senior year of college, she was balancing coursework, lab research, and new motherhood. With determination and the unwavering support of mentors who recognized her potential, she completed both her degree and a master's in biology, proof that resilience and community can change the course of a life. Her journey has since spanned nonprofit research, global CDMO operations, and leadership in cell and gene therapy. Along the way, she's helped build commercial infrastructure for life-saving treatments, guided teams through scientific and operational challenges, and shown what it looks like to lead with both empathy and precision. Today, she's channeling all of that experience into a mission that unites humanitarian values with cutting-edge science, making advanced therapies more affordable and accessible worldwide. So please welcome my guest today, Chief Operating Officer of Caring Cross, Megan Forrest. Hey, Megan.
Hello, how are you?
Well, how are you?
Doing very well, thank you.
Excellent. And it's lovely to talk to you on this Friday afternoon. Thank you so much for taking the time out to spend some time with me. I'm really excited to talk to you because you are right in my dynamic of my business is biotech and nonprofit, and you've kind of straddled both sides. So I really want to explore that with you, and thank you for being my first guest that has actually straddled both sides on
Absolutely.
as far as that concerned. How good is that? So, but you started in bioscience, right? Is that
I
where you?
did.
Okay. So
Yes,
talk to me about that. Talk to me about how you started your career.
absolutely. I'm going to take you back to my senior year of high school, actually,
Okay.
because I was between multiple ideas for what I wanted to do, thinking I could figure it all out in high school, right? So first I thought lawyer. I loved Matlock. It's one of my favorite shows. And then as I went through the years in high school, I really started developing a love for journalism. At the same time, also a love for science. And I was really torn between the two. So my senior year, we had an AP English assignment and we had to write a paper on anything. And I chose to write about the Ebola outbreak. So Hot Zone was the it novel at the
Yep.
time. And I loved it. I just ate it up. And I wrote about the Ebola virus and infectious diseases. And I thought this might be the path I really want to take. I was still torn though. Actually, originally, I was supposed to go to University of Maryland for a journalism program. And 2 weeks before, gut just said, this is not it for you. I switched schools, I switched majors, and I ended up majoring in biochemistry and have not looked back since then. I had a great opportunity to start working in laboratories while I was an undergrad, and just my love for science continued to grow from that point.
So when you made that decision, looking back on that, because we all make crazy decisions, don't we, when we're in high school? I actually still make them now, but you know, I don't have an excuse anymore. But when you look back at that moment of switching, who do you think you were really listening to in yourself? It was a gut thing? Did other people influence it? What made it happen?
They did. So I have a pretty strong faith. So I prayed about it a lot. And then I went to my dad. He's engineer and always has good, solid advice. And he just said, really think about what you're feeling and what you think is the right path. He said, either way, it's going to work out. And I just knew with his reassurance, I knew this was it.
You always need either mum or dad's reassurance that
Yes.
you're on the right path, don't you? I
Yes.
always find that. So obviously, the way that you communicate, you've obviously still got that kind of journalistic instinct in you. How do you think that your love for writing still shows up in your work today?
Handy a number of times. Actually, one in my early career, and one of the positions I held was as a scientist at another nonprofit for tuberculosis vaccine research. And we had to wear many different hats at that time. And I had the opportunity to write a piece for the Huffington Post, actually, on an experience that I had when I was traveling in South Africa to visit one of our clinical trial sites. And I was like, I cannot believe it. Both of my worlds are colliding and we're coming full circle here. So I've been able to find ways along my career path, either volunteering for them or them falling into my lap, where I've been able to utilize that skill set, which I've absolutely loved.
Yeah. I mean, it is a skill set. If you have it, it never goes away, right? You can.
I like to think that.
I bet you don't use ChatGPT as often as other people do.
No, and I had to tell my middle daughter, like, you can't rely on that. You need to learn how to be a good writer, please.
Yeah.
It's a frequent conversation.
Exactly. Yeah. Look up from your phone and talk to people. So now I know you won't mind me saying this, but obviously when you were at college, in your final year of college, you found yourself with child.
I did.
What did that early period, what happened with that? I do know that you had a really good support system, but how did you balance that? How did you, because you continued to study and you started working and everything else. How did you make that work?
Looking back now, it all seems a little crazy, to be honest. At the time, though, it was more, I know what my goals are, and we're just going to find a way through. So just to give a little bit of background, between my junior and senior year of college, I did find out I was pregnant, which was not planned. And I still remember the sweet nurse at the University Health Center who broke that news to me. And we had been chatting before the result came back, and I said, I want kids. I want a lot of kids, but this is really not good timing here. And when she came back, she said, it's positive, but let me tell you something. It's never a right time to have kids. And you're going to look back at this moment years down the line, and you'll never be able to imagine your life without this child. And those were the perfect words. I've never forgotten about her, or her saying that. And she's absolutely correct. My child is now 22, and she just graduated. So she's the age that I was when I had her. And it's been a wild ride, but worth every moment. But at that time, I was fortunate enough to not only have local family support, but during that year, I was working in the biology department at my university. And I'd been there for a little over a year at that point, and they were already like family. And they just embraced me and the situation, and it could not have worked out any better. The professors, the PIs I worked with, the administrative assistants in the department, they all rallied around me, and that made such a difference. One of the admins in the biology department said, Megan, I looked at your transcript, and I think you need to go to do this grad program. You have almost all the required courses. You just need 2 more and do the lab courses, and then you have a master's degree. And it was at the same university where I was at the time. Just the fact that I had these people who went out of their way to do that meant so much. And it gave me that strength to keep pushing through, because there were definitely times where I just wanted to go to sleep.
Yep. Let me pull the covers over and wake me up when it's over.
I was so tired. I also was struggling outside of this great bubble of professors and PIs who knew what was going on. The majority of the professors I had for my major classes didn't know. I didn't tell them. I carried this embarrassment and shame that I shouldn't have. Looking back, I should have just told them what was going on. So
that's easy to say in hindsight, though, isn't it?
I know, it is much easier. Absolutely. I just remember this one moment, and Maddie was about 5 months old, and I was in the middle of my hardest semester I had. Every hard class happened to be that semester, and I just wanted to go to bed. And I just prayed, let me get through this next day. And I did, and we made it. And I'm very, very grateful to that support system that I did have and continue to have. So I did do that master's program. I stayed the extra year, brought Maddie along. She definitely spent time. She had her own
I bet she was I bet you had no shortage of
nope.
childcare with them.
They all wanted to claim her. Yes. So I was so blessed to have that and to have that continued path and continued goals to reach. And then even afterwards, I finished the master's program, and one of the PIs came to me and said, I want to offer you a job. Can you stay on and continue to work? Which I did, and I loved it. So I gained a ton of experience and knowledge on the academia side. And I stayed there until he was getting ready to retire and funding was running out. And it was at that point where I said, okay, I need to start looking. So let's see what else is out there. And that led me.
It was that PI, wasn't it, that then told you to go into industry?
So that's actually, okay, this is a really good story. I was trying to decide, do I go on and get my PhD, or do I go into industry? And it was very interesting, the advice that I got from the different professors. A lot of the male professors said, you should continue to get your PhD. I had one incredible mentor, a female professor, and she said, listen, you can do that and you could be successful at that. But if that is not what is driving you, you have your own little family to think about, and you should look into industry. And I took that advice and I started to see what was out there. I did get accepted into a PhD program, but ultimately I got a great opportunity to work at a nonprofit for tuberculosis vaccine research. And I ended up being there almost a decade. And I met my husband there. So it all worked out.
It was supposed to be, right?
Yeah.
Excellent. So what part of your working life did you spend in biotech? Because didn't you work in a CDMO?
I did. So that came after the nonprofit. So I was at Eris for almost a decade, and then funding was pulled, unfortunately. Otherwise, I probably would have stayed there my entire career. And I had the opportunity at that point to transition over to a CDMO who was still in vaccines. And I worked there for a while and then decided to move into cell and gene therapy. So when I was still at the nonprofit, and we were given a year's notice that we would be shutting down. And I took that as my opportunity to transition more into project and program management. Still wearing the scientist hat, but I got the opportunity to gain more experience there. So when I moved over into the CDMO space, I began my career there in project management and officially had left the bench at that point. And so I was there for a while in the vaccine CDMO space, and then got the opportunity to move into cell and gene therapy again in project management. This time it was a new opportunity that would involve really pulling on a lot of skills that I gained over the years and managing to acquire a lot of new ones. So I was tasked to help start up commercial lentiviral vector operations for a large biotech that's global. And we had a very small team of people, and it was an incredible opportunity just to gain new insight into how to build an operation like that. Blood, sweat, and tears definitely happened. We did successfully manage to set up that commercial infrastructure and to bring through a client program that ultimately did receive BLA approval for their drug product and has been infused into the first patient. So that was a huge milestone, one that I'm very thankful I got to experience.
And during those parts of your career, you were involved in a lot of global travel, a lot of back and forth. How did you do that? Because your family had grown by then as well, hadn't it? This week's episode of She Leads Biotech is brought to you by Facilitate, the team behind Advanced Therapies Week. the biggest event for the global cell and gene therapy community. Join over 2,000 leaders in San Diego, February 9th to 12th, for high-value networking, bold ideas, and real connection. Don't miss the Women in Advanced Therapies Congress, a powerful space for women and allies to share stories, insights, and support. Visit facilitate.com/Advanced Therapies Week and use She Leads 20 for 20% off your ticket. That's SHELEADS 20. See you in San Diego.
It had. So when I was still at the original nonprofit, it was just Maddie at that point, and I had more limited travel then. So we were able to manage well enough. And then honestly, through the next several jobs, it was more limited in the international travel. So
Right.
it worked out well.
Good. Oh, that's good. Okay. I just imagine Maddie being on your back, going through the airports to get on the way. So you did the CDMO work, you've covered both sides, and then you took a year out. You took a year off. And that decision to do that, which I have to say, I totally envy anybody who does it. Well, how was that? Was it hard? Was it a hard decision, or was it a freeing decision? And what happened when you came back from that?
Yes, it was a very freeing decision, to be honest. It took me a little bit of time to get used to not going full force, and those commercialization efforts really took a lot out of me. And so just taking that time to sort of recuperate from that. And then I was thinking, I have all this extra time now, and I'm not one who can sit still. So I started volunteering at my children's elementary school. So at this point, Madeline was in college, and I had two in elementary school, kindergarten and second grade. So Caitlin and Liam had arrived by this point. And I took every opportunity I could to go in and volunteer at the school. But even then, it was wonderful, an absolutely amazing year at home with the kids. I felt partially like I owed it to them.
Yep.
You know, that constant mom guilt struggle, I really had a difficult time with those prior 3 years where I was working on that program. And you always do the best you can. And my strategy, I heard someone explain this really well. Every day you're going to have balls in the air. Some are plastic and some are glass. Sometimes the glass ones are your family and sometimes they're work. So keep the glass ones up and let the plastic ones bounce. So I tried to do the best I could, but really felt like I needed to make up for some lost time with my kids. So That year was a really good recovery period. And then towards the end of the year, I was twiddling my thumbs and I felt this strong pull that I wasn't done yet. There was more that I needed to do. And I had gotten the call from Boral Dropulich, who is absolutely amazing. I had worked with him at a previous organization, and that's how we first got to know each other. And he knew I was taking time off. He also probably knew I was done with my time off. And he said, hey, we're trying to do something amazing at Caring Cross. Can you come lead operations here? And it was an easy yes. And I haven't looked back since. So that was a little over 2 years ago that we had that conversation.
So you're about to come into your first year as COO at Caring Cross, aren't you? Yeah, yes. January, your anniversary?
Yep.
Yeah.
Very good.
So, and this to me seems like the perfect blend of if you could sit down and pick your perfect job that encompasses all the bits that really bring everything together, this would be it, right?
It would be. It's the perfect job I never knew I would end up having, to be honest.
So tell me about it. Tell me, because I know it builds in your scientific side, the humanitarian side, the science. I mean, it's just all there. But talk to me about the mission of Caring Cross.
Yep, absolutely. So as we mentioned already, Caring Cross is a nonprofit organization We're focused on accelerating the development and implementation of advanced medicines. So like CAR T therapies, stem cell gene therapies. We do the R&D ourselves. So we're developing this pipeline of products. So for indications like leukemia, lymphoma, HIV, sickle cell disease, autoimmune conditions, not only are we developing those products, but we're also developing the manufacturing processes and the testing strategies that are needed to get these products manufactured and into the patient to treat their indications. And we're doing this with the goal in mind of affordability and accessibility. That is our ultimate goal. So we've partnered with a spinoff from Caring Cross called Vector Biomed. They're a for-profit public benefit corporation, and we need them. So Caring Cross is on the R&D side and the development side. But when you're putting product into a patient, you need a certain grade of material. So that's what Vector Biomed provides to us. We transfer the products and the manufacturing processes to them, and then they make the lentiviral vector that we need to then send out to local manufacturing sites around the world that we've transferred our processes to. So by doing this partnership, we can offer these materials at a lower cost because of how we're operating synergistically together between Caring Cross and Vector Biomed. So I left out a really big part of what Caring Cross is doing. So besides developing the products and the processes, we're teachers, and we want to teach anyone who is willing to be a part of this collaboration and this manufacturing network what our processes are. So we can transfer that know-how to them, and they can manufacture these cell products locally. So it's cutting out that middleman of the centralized manufacturing. We're decentralizing it. We're point of care manufacturing. And that's the model that we are really trying to show is feasible and it's possible. And we can teach these processes to these local hospitals and centers so that they can treat their patients with the process that we've developed that is lower cost with materials that we're able to provide at a lower cost and allow that and enable that affordability and accessibility.
Those are the facilities that are in the countries that you're servicing. Is that right?
Exactly. Yes. So there are a couple different options that these collaborators can take. They might already have clean room space available if they're a hospital setup. And then we just tell them, this is the equipment that you need to acquire. This is our process. We have training videos. We offer training on site, very collaborative interaction to make sure they're comfortable with the process. And then we are then able to work with Vector Biomed to provide these lower cost lentiviral vector intermediate materials and testing materials that they need to make that final drug product.
How does Caring Cross make its money? You don't have fundraisers per se going out and looking for donors.
Not yet.
Well, if you need them, I can provide those people for you. If you need your donors, people to go out there and get the donations, then that's what we do.
Fabulous.
Let me know. But what happens at the moment? Where does your income come from?
Yes, so some are coming from grants, and that helps support our R&D pipeline. Others, we have special collaborations where there is funding associated with it in exchange for deliverables. And there are different scales of what these collaborations look like. Like we'll have some that we know they're trying to treat the poorest of the poor. And so we have sort of a sliding scale of how we're operating with them. Again, we just want to make sure whatever money we're bringing in is enough to keep us being able to continue to fund the research, keep our doors open, so we can do this as long as possible.
Yeah, you're not looking to make major
money,
because then that defeats the object of who you are, doesn't it?
Absolutely.
The one thing I'm curious about, how do you balance, so I imagine there's a fine balance of the scientific rigor and the humanitarian vision. How do you balance that?
That's a great question. So I'm not sure how to answer this one. We'll come back to this one.
We'll come back to it if we need to. So, as I mentioned earlier, we're coming up to you've been with Caring Cross 2 years, and this coming up to your first year as its COO. What's been the biggest challenges that you faced in taking on that role? Because it's a big role, and the kind of buck stops with you, right? How did it pan out as opposed to what you thought it might be? Or was it better than what you thought it might be?
I don't know if I actually ever thought of what it might be. That's a great question.
I'm just going to do it and see what happens.
It's funny, a few months ago, my son asked me, Mommy, were you nervous when you started your new job 2 years ago? He's like, how do you know what to do every day? And I said, that's a really good question. I said, actually, this might be the first job where I haven't been nervous because it's drawn on all of the other experiences I've had, the scientific side, operations side, logistics, you name it. It's all wrapped up into what I'm doing now. So from that perspective, it seemed like a relatively not easy, but easier step to take doing this. Everything just came together, which was, I feel so blessed that I've had this opportunity to do this. The trickiest part of this that I have learned is probably I play the role of therapist a lot. Probably daily.
Willingly, or does it just happens?
Both. So I'll say it's the hardest part of my job. It's also the most rewarding. My job is to make sure operations are running smoothly. Life is never easy. Work is never easy. There are ups and downs. So it's navigating through those situations, trying to make sure the teams feel supported. So I feel like I tend to naturally maybe go into mom mode, just to make sure they're feeling that support and we get a plan to work through something, whether that is strictly related to experimental design or something more work related or something that's more maybe relationship related, how to get along with this person or this group or this client. So that's probably the hardest part of the job, but again, the most rewarding for me.
I think, as you said, it feeds in to every aspect, not just of your career, every aspect of your life. You had to kind of grow up pretty quickly from an early age and make those decisions. And I don't think it matters at what age you are. I mean, I was 31 when I had my daughter, but it changes you. You look at all things in life differently. And people actually said to me, I took a short time off when she was born and then went back to work, and I was managing a team of people. And they actually said to me over time that made me a better manager. Being a mother made me better at being a manager at my job, which was a little bit off-putting because I already thought I was an awesome manager, but clearly I wasn't. Clearly I wasn't. So I think that probably even answers my previous question of the scientific rigor there, because it seems as if it just came so natural to you because it was a culmination of everything that you'd kind of been experiencing throughout your life.
It seemed that way.
And very blessed. I mean, seriously, there are not many people that have that kind of perfect storm, I guess, where everything just aligns in the right, most positive way. So kudos to you. Congratulations. I'm very conscious of your time, so I really appreciate you taking the time out to talk to me. I do want to ask you one question. Usually I ask my guests what advice they would give to somebody coming into the biospace or somebody thinking about that. I just want to mix that up a little bit and to a young woman who may have just found out she's pregnant and probably feels like her future's over. What would you say to that person?
Tell them that life is not always easy or fair, but if you can lean into your community and look for that support, that your internal resilience can really make possible those things that you feel can't be possible for you in that moment.
Yep.
I, again, am so blessed for the community and the mentorship that I had, that even when I'm sure I was so significantly doubting myself, having them around me made me feel like I can take that next step. I can keep pushing forward, I can still reach my goals.
Yep.
So I wouldn't want anyone in that same position to think this is it. This is the end. And I realize not everyone has that same type of community, but if there is anyone they can reach out to and look for that support, it really does make a difference. Even if you're ashamed and you feel embarrassed like I did back when I was in school, looking back now, as you said, it's a lot easier looking back now
Yep.
to say, oh, I shouldn't have done that.
Yep.
Make those connections, build that community, because you never know what type of support, what type of opportunities could fall into your lap. And resiliency is very important. And once you realize you can make it through, that's just your springboard in the future. My kids taught me flexibility, patience, and perspective. And I think just leaning into those and getting that overall perspective and where you are in the moment right now versus where you can be in the future, leaning into that community and just taking it a step at a time, you can do it.
And support can come from the most unusual and unlikely places at times, can't it?
Absolutely.
So it's don't expect it to show itself as what you expect it to be, because it could be the complete opposite.
Absolutely. If that one administrative assistant had not come to me with that idea of doing that master's program, I probably wouldn't have done it. I was so caught up in the day-to-day, and that was really a big turning point, one of the big turning points to guide the rest of my career.
Actually leads me nicely into my final question. You've had an incredible journey, and you're still so young, and you've had an incredible journey. It's amazing.
I don't feel so young.
Well, maybe not today, but trust me, you are. When you get to feel like me, then you'll know. But what surprised you most about your journey so far? If you look back on it, in a good way, bad way, whatever, what's been the biggest surprise in your journey so far?
I never in a million years would have thought I would be COO of a biotech. When I made that decision to go from journalism to science something, I thought it might be doctor or some type of researcher. And so I think having all those twists and turns lead me to where I am now, honestly, is probably the biggest surprise.
Well, I think you've had an incredible journey. I really do. It's been an absolute pleasure speaking to you, Megan. Thank you so much for sharing and being so open and open with your journey. I think that there will be listeners / viewers, whichever route they choose to do, that will really get a lot from this. So I really appreciate your time, and I wish you continued success with Caring Cross. And obviously, if you do need those fundraisers out there raising funds, give me a shout. We can do a deal. We'll get rates for guests.
I love it. Thank you.
Well, have a fabulous weekend. And thank you so much for talking to me.
Absolutely. Take care.
All right. Take care. Bye-bye.
Bye.
Well, that's it for today. Thanks for joining me for this episode of She Leads Biotech. If today's story inspired you, subscribe, follow, and comment. Because when one woman's voice is heard, many more find theirs. Until next time, stay curious, stay courageous, and keep leading.